Hi, my name is Kevin McDonald. I'm a private practice podiatrist with InStride Foot and Ankle Specialists in Concord, North Carolina. And today I'd like to talk about the future of podiatry practice, specifically for small and medium-sized podiatry practices. And we're going to use the concept of lean podiatry. And you might say, well, what's lean podiatry? And if you're old enough to remember, back in the 1970s, Japanese companies started coming over to America with well-built cars and really cool electronics, and they were a very good value, and they basically kicked American butt. And the American manufacturers asked the Japanese counterparts, what are you doing? And the answer was Kaizen. And the American manufacturers said, well, what's Kaizen? And the answer to that is continuous incremental improvement, constantly getting better and better. So that became a big part of the 1980s. We were doing quality improvement programs. And then somebody in the 90s thought to themselves, well, maybe there's another way to look at it also, and that is lean management. And lean management is, yes, you need to get better and better in your service and products, but you also have to become more efficient. You have to use less resources and have less waste in the system. And so I'm saying lean podiatry is doing more. And it means doing more for your patients, doing more for your staff, and doing more for yourself, and using less. And primarily I'm talking about using less money, but also time and energy. Let's talk a little bit about the healthcare system in America. It's a vast marketplace. It constitutes about 18% of the entire economy. And right now the seas are getting pretty rough in that ocean. There's a lot of change going on, and nobody's exactly sure what's going to happen. One component of the equation is the government and Medicare, and they are the ones that make the waves in the ocean, and they're not too susceptible to market forces. They make the market. Also, we have insurance companies. The insurance companies have a lot of money and a lot of organization and political power, and they're ready to do battle in the healthcare marketplace. And then you've got your hospitals and your large groups. I'm going to call them the party boats. They have a lot of people on board, they have a lot of power and a lot of money. And when you compare a small podiatry practice to the aforementioned entities, basically you're looking at a guy like this. He's basically got a very small amount of resources, relatively speaking. And he might be wondering, what are we going to do? What should we do to survive this coming storm in healthcare? And so one idea is just to sit tight, just keep going the way you're going. And for some people that might be an option. Particularly if you're getting very close to retirement, but as I'll talk about later, maybe not. What happens if it doesn't work out? What happens if the market changes and you're not ready? So what about joining a large corporation? A lot of people think about doing that. And a recent nationwide survey found that 73% of employed doctors would rather be on their own if they had the chance. If you're an employed doctor, you're no longer the captain of the ship. You're basically a worker. You do it their way or no way. You've got people coming by the office to help you, that is, tell you how to do things, and they're not bringing donuts. You've lost your leverage. You've signed a covenant not to compete. If you don't like it, you have to leave, and you can't open up down the street in most cases. You could actually be fired. So let's talk about a third option, and that means working together. And that's the rest of this presentation focus. When birds fly in formation, they go faster but use less energy. That's the definition of lean. That's the concept we're trying to promote. I believe there's 5 keys to future success in podiatry practices. The first is you have to do a good job. You have to help a lot of people with their foot problems. The second is you need to have quality medical records. Records are how you're going to be judged. And that's how you're going to eventually how you get paid. You need to code correctly. Miscoding, upcoding, sending in claims that aren't properly documented. This is not a good look for the future. The computers are getting smarter. The insurance companies are getting smarter. You need to code correctly. Patient satisfaction scores. That's another component of how you're going to get paid. I know a lot of you pay people to get you good reviews on Google, but the insurance companies and the payers are going to have their own patient satisfaction scores through their independent surveys. What do you think the fifth thing is? How about make more money, grow your business, be more successful? Those are the 5 things I think all private practice podiatrists should focus on. The problem is there's a lot of other things. What are you going to do about those? And I say consider outsourcing the rest, but rather than giving other people profits, do it to your own company. And that's where InStride Foot and Ankle Specialist comes in. We try to be lean with improved services, but lower costs. How do you do that? Well, one of the key components is having a common EHR system, practice management system. When you do that, you can develop templates to meet all the qualifications for good coding. You can develop best practices and learn from other podiatrists on how to best code things and do diagnosis and treatments. You're going to have lower costs because when you do billing services, everything's going to be the same. You can negotiate to get better rates on the systems, and you're going to get a lot of data. And data is part of the future of healthcare. You're going to have data. What about insurance relations? Well, it's tricky to add an associate. When's the last time you did that? We've got this down to a science. Our application processes are smooth, and we can add associates and change over to different tax ID numbers very quickly. Another thing we've done is had success in contract negotiations. A solo practitioner or a small podiatry practice with 3 podiatrists or so is going to have a hard time going into Blue Cross asking for raises. But because of our economies of scale and the largeness of our group, we are now at about 70 doctors. We can have success in negotiating contracts. Billing service. Now this service is optional. You don't have to do this, but we charge 3% of insurance collections, and that's about 2.2% of total collections, which is far below the average billing service. And the reason is there's no profit. We do it for cost. And the other thing about this is, let's say you have your biller get pregnant and have to take time off for a baby. Our company can step in and bill for you while she's out. You might ask yourself, well, how much am I paying my biller versus 2.2% of collections? And you can have your staff focus on the 5 key things and keeping billing as an outsourced service. Human resources. This is a very complex issue. It's hard to keep up, especially at a small practice with 2 or 3 employees. There's a lot of different hiring requirements, FMLA, E-Verify, different procedures for onboarding people. We've had success in health insurance shopping. Last year, our insurance for our employees went down through our negotiations. Also, do you really want your office manager looking up balances on FSA plans? I think we should go ahead and focus on the 5 key things. Our 401k plan has about 8 figures in investments, and what that does is lower our annual costs per person. Accounting. A lot of people are paying an accountant a lot of money to do their bookkeeping, and we can do this at cost. You get better reports than I have seen from standard accountants. In the event you're interested, we could do bill paying for you, and there's sales tax reporting, another thing that's not a 5 key thing in being successful in podiatry. Compliance. This is a huge issue. You need to stay on top of it. We have our own compliance department that's going to keep the records straight, do the inspections, make sure you have the trainings. There's a new set of compliance coming out on infection control. And we also do chart auditing of everybody in our company, making sure everybody's on the same page and doing the proper coding, proper documentation of their services. There's group advantages and cost savings. We have excellent contracts for purchasing. We have excellent contracts for insurance. We had a young lady working with us. She was a young woman with 2 children. She took her family on vacation, and she got hit on the highway by a wrong-way drunk driver, and she's totally disabled. Well, she had a policy that was supposedly a good policy, but that policy doesn't want to pay. That policy delays. That policy says, oh, you're going to get Social Security, therefore we're going to take away your benefits. So what we did is we went to the best insurance company we could find, which was Northwestern, and we got a group disability policy for every doctor in our group, up to $10,000 in replacement income per month, and it's only $116 per month. You can't touch that as an individual or even a small group. Ancillary income. Our pathology lab is doing fantastic. We have improved service because we can call up our pathologist anytime. Our profits are excellent, and we're providing a good product for our patients. We have other possibilities listed here. I don't have time to go through them all, but let's just say that if you have 70 to 75 podiatrists, you can work together to get ancillary income. So who is a candidate for lean podiatry? To me, people that want to operate their own practice. If you would rather give up your own practice and just work underneath someone else as an employee, then this probably isn't for you. I will also add that it's probably good for someone looking to sell their practice, because young podiatrists today don't want to deal with a lot of this stuff. They recognize the wisdom of outsourcing and making yourself focused on the key things to be a successful podiatrist. We like people to have a lot of patience. We find this is the best candidates as far as negotiating good rates for payment. And we need to have excellent reputations and qualifications. A lot of people get nervous about joining a group like this, and I feel like, what do you got to be nervous about? All you have to do is reasonable standards. You have to follow the HIPAA guidelines. You have to encrypt your data. You have to code correctly. If we have somebody from the Coding Institute that says what you're doing is wrong, you have to change. So little things like that, that is part of being in a group practice. So how much does it cost? Let's just say the cost is going down and it's very affordable. I'm not going to tell you the cost now. I will tell you the disability insurance is $116 per doctor per month. You can keep your original disability policy if you have one, and this one will pay in addition to it, or you can just drop the one you have. We also have variable accounting expenses based on the size of your operation, and again, the optional billing service, which is totally up to you at 3% of collections. In summary, I think you need to be agile. I don't think you should sit still. I think you need to look at what's going on and make moves to position yourself for success. There's a lot of waste in healthcare. I think you should take waste out of your practice. And by combining with others, I think it's possible. Working with others, that's going to be key coming forward. I don't think it's going to be as easy to keep track of everything you need to keep track of as a sole practitioner. If you want to get lean, think about joining InStride Foot and Ankle Specialists. You can still be the captain. You just have a better boat. Feel free to email me anytime, and thank you for listening.